For the last 85 years, we have been focused on building power for healthcare workers. In 1933, SEIU Healthcare Minnesota started with 200 hospital workers in Minneapolis and St. Paul. We are now 35,000 strong across the state of Minnesota. At the same time as the famed Teamster strike and sit-down strikes to gain union recognition for jobs which were predominantly male, healthcare workers, mostly women, and people of color were also fighting to gain recognition. For our members, it was a bigger fight. The laws passed to protect other workers' rights to form unions and advocate for a better life for their families left out jobs held by women and people of color. The National Labor Relations Act excluded healthcare work, domestic labor, and farm labor, casting it aside as not real work. In Minnesota, members at Abbott, Swedish, and St. Barnabas did not let that hold them back. They united and voted to strike until the hospital employers recognized them as a union, and the first healthcare union in the country was born. In 2017, members at Albert Lea voted to strike after nearly 2 years of bargaining. The one-day strike stretched into a week when Mayo locked workers out over Christmas. Undeterred, members continued to fight until they won a contract. Their struggle for recognition was also the struggle of our home care members in 2014. After facing the same battle over what was considered to be real work, we fought for the right to organize and won. For the past 85 years, our union has been winning national standards for healthcare workers by fighting against racism and gender discrimination in the workplace and in our communities. In 1949, SEIU members bargained to abolish gender-based wage scales, establishing equal pay for equal work. That same year, our members demanded a 40-hour work week. Our union was the first healthcare union in the country to establish a pension plan for members and the first to win every other weekend off. This year, we fought for and won a $15 minimum wage in Minneapolis and for all our metro area and Rochester hospitals. At the same time, we successfully helped pass paid sick time for all workers in Minneapolis, St. Paul, and Duluth. Our home care members won the first paid holidays for home care workers in the U.S. and created a path to connect caregivers with clients. We fought to extend the DED immigration program on behalf of our nearly 1,000 members in long-term care who immigrated from Liberia. We invited members from all over the state to join in workshops on immigration rights and how the immigration system affects care in our state. We've joined together with other community groups in a coalition called Our Minnesota Future to ensure a union-friendly governor is elected to protect all workers' rights. We've established a community organization, Communities United for Rochester Empowerment, or CURE, where Rochester citizens can fight for positive change to make sure Mayo lives up to the responsibilities it has to the community around housing, jobs, transportation, healthcare, and justice. As caregivers, we built this great union to make sure that our work continues to be seen as real work, that we have the right to stand up for our patients and be treated with dignity. We have achieved great things together over the last 85 years, and there's no stopping us now.